Well, people have been microdosing psychedelics with increasing popularity. Thousands of people swear by microdosing, saying that it boosts their mood, their creativity, their ability to get stuff done. Psychedelics are now coming back in favor over the last 10 to 15 years. And the common psychedelics that people microdose are mushrooms, magic mushrooms, which have the active ingredient psilocybin. People also dose with LSD, otherwise known as acid. And the idea of microdosing is taking about a tenth of a regular dose. If you take a regular dose of psychedelics, you hallucinate and have a mystical experience. And interestingly, psychiatrists recently have been studying this to help alleviate some of the most difficult psychiatric conditions, such as deep depression, treatment-resistant depression, alcohol use disorder, PTSD. And it's been the preliminary results are very, very promising. So people think and are experimenting with taking a microdose, a sub-perceptual dose, a dose of LSD or a dose of mushrooms, about a tenth of what a normal dose is. You don't hallucinate, you don't have any perceptual distortions. But again, people are finding it really, really helpful for their mood, their productivity, and their creativity. But is there evidence that microdosing works and actually helps people? Sometimes when you take a pill, for example, we have the same problem with CBD. You take a pill and people think the pill is going to make them happier, more connected, more relaxed, and more productive. And the pill actually does make them more happy, relaxed, and productive and creative. But this is called the expectancy effect, because if you expect the pill, it's also a form of the placebo effect. So some studies where they do surveys of people who microdose, most of the studies say that very positive, excellent, compelling evidence for benefits for creativity and for mood. But if they do randomized, double-blind, placebo-controlled studies where you don't know what's placebo and you don't know what's the active dose, they haven't shown a benefit in microdosing. And just from personal experience, I can tell you I've experimented with microdosing and I don't notice the difference.